First procedure. Prior to performing the procedure, introduce self and verify the client's identity using agency protocol. Explain to the client what you are going to do, why is it necessary, and how he or she can participate. Discuss how the results will be used in planning further care or treatments. Second procedure. Perform hand hygiene and observe other appropriate infection prevention procedures. Third, provide for client privacy. Fourth, inquire if the client has any history of the following: problems with neck cramps, neck pain, or stiffness, when and how any lumps occurred, previous diagnosis of thyroid problems, and other treatments provided, like for example, surgery or radiation. Next, inspect the neck muscles, sternocleidomastoid and trapezius muscles. For the abnormal swellings or masses, ask the client to hold the head erect. Next, observe the head movement. Ask client to move the chin to the chest. Move the head back so that the chin points upward. Move the head so that the ear is moved toward the shoulder on each side. Turn the head to the right and to the left. Assess the muscle strength. Ask the client to turn the head to one side against the resistance of your hand. Repeat with the other side. Next, ask the client to shrug the shoulders against the resistance of your hands. 8. Palpate the entire neck for enlarged lymph nodes. Face the client and bend the client's head forward slightly or toward the side being examined. Then palpate the nodes using the pads of the fingers. Move the fingertips in a gentle rotating motion. When examining the submental and submandibular nodes, place the fingertips under the mandible on the side nearest the palpating hand, and pull the skin and subcutaneous tissue laterally over the mandibular surface so that the tissue rolls over the nodes. When palpating the supraclavicular nodes, have the client bend the head forward to relax the tissues of the interior neck and to relax the shoulders so that the clavicles drop. Use your hand nearest the side to be examined when facing the client, and use your free hand to flex the client's head forward if necessary. Hook your index and third fingers over the clavicle lateral to the sternocleidomastoid muscle. When palpating the interior cervical nodes and posterior cervical nodes, move your fingertips slowly in a forward circular motion against the sternocleidomastoid and trapezius muscles. To palpate the deep cervical nodes, bend or hook your fingers around the sternocleidomastoid muscle. Palpate the trachea for lateral deviation. Place your fingertip or thumb on the trachea in the suprasternal notch, and then move your finger lateral to the left and the right spaces, bordered by the clavicle, the anterior aspect of the sternocleidomastoid muscle, and the trachea. Then, inspect the thyroid gland. Stand in front of the client. Observe the lower half of the neck overlying the thyroid gland for symmetry and visible masses. Then ask the client to extend the head and swallow. If necessary, offer a glass of water to make it easier for the client to swallow. Document findings in the client record using printed or electronic forms, or checklists supplemented by the narrative notes when appropriate.